Hello, hope you're well. It's Dr. Sahar Roked, and I'm just going to give you a bit of information about menopause and skin and hair changes because it's something I get asked about a lot. I had someone message me the other day going, I've really noticed my skin is a lot drier, it's a bit more crepey, almost scaly. What's going on there? Why am I getting funny little like red bumps on my arms or my legs? Why is my face just a lot drier? I'm getting acne. Why am I getting acne? I thought that's what teenagers get. What's going on? And also, really commonly, people notice their hair is just shedding throughout the menopause. So I thought I'd give you a little bit of pointers around it and try and explain why as well. So in the menopause, your hormone levels drop a lot. Your estrogen really drops, and so does your progesterone. Now, in terms of estrogen, that is so important for collagen production. So that's really important for your skin not being dry, not seeing the lines as much, which we don't like, and just having a better texture to the skin. So when people tend to go on hormone replacement therapy, if they choose to do that, they often do notice their skin improves, not just on their face, the collagen production's coming back as estrogen's in the body, but also on their arms and legs, the skin overall is improving. In terms of these little bumps and acne and things like that, that can be due to the testosterone levels fluctuating. So just like when you start your period and you're a teenager and you get changes in your skin and your body's adjusting to a new hormonal environment, the same thing's happening at menopause. Your body's adjusting to these new hormones, and you might have some testosterone, but your estrogen's gone really low, so therefore you might get more acne and more hairs where we don't want it as well. Also, just the fact that the estrogen and progesterone and even possibly the testosterone has dropped quite a lot could cause your body to be going, hey, what's going on here? And you could get some outbreaks of spots, or you can get some hairs where you don't want them. So that's the main reason. Now, you can use some facial creams that have some hormone in them. That's one of the things that one of the laboratories I use make. And they can either be an estrogen-based cream or a testosterone-based cream. It kind of depends what your issue is. So that's something I would talk about with my patient, and then we'd look at the formulation around that, just to help get a little bit of weak estrogen or progesterone into the skin where you need it to help improve the texture and the fine lines and things like that. Hair loss. So that generally happens for one of two reasons. One, the progesterone really drops in menopause, and that can affect hair and skin. So in pregnancy, you have tons of progesterone in your system to sustain the pregnancy. And what do lots of pregnant people have? Lovely glossy hair and beautiful glowing skin. So progesterone is great for hair and skin. That's the example I always give. Once you're over the morning sickness, at least you have lovely hair and lovely skin, right? So you don't need that much progesterone now for your hair and your skin, but you do need some. So by taking progesterone, and this is bio or body identical progesterone, not synthetic progestin that has no benefit on your hair or skin. All that does is protect your womb. So a body or bio identical progesterone is going to help improve your hair and your skin, as well as protecting your womb, which is obviously extremely important. The other thing to know in terms of hair loss is that it's quite often caused by stress that happened 3 months ago. So I often tell people, if they've had a bout of hair loss, what was going on for you 3 months ago? Was it very stressful? Did something happen in your private life? Was it just all these hormonal changes making you very upset and emotional? Because that could be the reason why you're now having the hair loss 3 months on. And we can address that, the cortisol. I'm always talking about it with lifestyle changes and also supplementation. So that's a really important factor to also address. There are other things we can also do with the hair. There are great supplements out there like Viviscal Professional, taking biotin, zinc, but also the labs I use, they make hair tonics, so specific hair tonics with hormones in them, so that can be really useful if you're in menopause, but also some of the other agents that help prevent hair loss and help hair regrowth, like minoxidil and finasteride. And that's something I can also work with my patients on. So I hope that's been helpful to give you a bit of an indication on what's going on for hair and skin, and I will speak to you soon.